Hematemesis in cats. Hematemesis, or the vomiting of blood, can affect a wide range of systems, depending on the source. The gastrointestinal system may be affected due to trauma, ulcer, inflammation, or the presence of a foreign object. A hemorrhage may affect the heart, cardiovascular system, resulting in a heart murmur and or low blood pressure. Abnormally fast breathing due to severe hemorrhage can occur. A clotting disorder, coagulopathy, can lead to hemorrhage in the stomach or intestines, and can also lead to hematemesis. Other causes may be a disruption in the lining of the tube connecting the mouth and stomach, esophagus, or an irritation of the stomach or intestines, which leads to inflammation, bleeding, and, eventually, the expulsion of blood through vomiting. Alternately, blood may originate from an inflammation or injury to the mouth or lungs, respiratory system, after which it is swallowed and then thrown up, regurgitated. Symptoms and types. The primary symptom of this condition is the presence of blood in the vomit, which may appear as fresh blood, formed clots, or digested blood which resembles coffee grounds. Other symptoms include lack of appetite, anorexia, abdominal pain, and blackish, tar-like feces, melena. A physical examination may also find a low red blood cell count, anemia, in which case additional symptoms can include heart murmur, weakness to the point of collapse, and rapid heartbeat. Causes. A wide variety of causes may be responsible for hematemesis. Ulcers, or gastrointestinal diseases, such as inflamed bowels from inflammatory bowel disease, IBD, can both be causes for hematemesis. Various metabolic, neurological, respiratory, and viral infections may be responsible for incidence of hematemesis, as can conditions such as liver failure, head trauma, or heartworm, respectively. Coagulopathy, or lack of proper blood clotting, may result from liver failure, or a reduced blood platelet count, thrombocytopenia, due to drug exposure. Ingestion of rat poison can also be a cause of coagulopathy with concurrent vomiting. Hematemesis may also follow a traumatic incident, such as severe burns, heat stroke, major surgery, exposure to poisons from heavy metals such as iron or lead, and snake bites. Exposure to toxic plants and pesticides may also cause vomiting of blood. Critically ill animals are at a higher risk for hematemesis. Other risk-inducing factors are the administration of certain drugs, such as NSAIDs, nonsteroidal anti-inflammatories, shock, or a reduced count of blood platelets, thrombocytopenia. Diagnosis. Tests for diagnosis may include blood tests, and urine, and fecal analysis. Imaging tests such as ultrasound and X-ray may also be used to pinpoint inner disturbances. Through these diagnostic tests, the diagnosis for hematemesis may range from any number of the aforementioned causes, from contact with toxic substances to liver damage. Treatment. Treatment varies greatly depending on the cause of hematemesis. Any underlying cause must be treated upon diagnosis. After this cause is identified and removed, if vomiting is no longer excessive, recovery may continue at home. For severe internal bleeding, ulcer perforation, or excessive vomiting, inpatient care may require emergency treatment for hemorrhage or shock, possible blood transfusions, and for treatment to replace fluids lost through excessive vomiting. Living and management. A delicate diet of easily digestible foods is recommended after incidence of hematemesis. Foods should be low in dietary fat and low in fiber so as not to stress the digestive system. Further care is dependent upon the cause and on the consequent treatment given for hematemesis. Prevention. Hematemesis due to the ingestion of toxic substances can be avoided by ensuring that your cat does not have access to poisonous plants and foods. In other instances, a healthy diet may aid against illnesses related to hematemesis and any resultant complications.